Hello everybody, I'm Dr. Eileen West. Very nice to meet you all virtually. I'm going to give just a minute for the remainder of the connections to happen here. All right, let's go ahead and get started. Well, welcome everyone, and thank you for taking the time to join me today. I am Dr. Eileen West, and I'm here to talk to you about a few things. The title of this presentation is Why You Deserve Better Health Care. And in the course of this discussion, I'd like to be able to share a little bit about who I am, about the practice model that I offer for internal medicine, and why you might benefit from coming to see us. I want to invite you to leave me questions in the chat section of this video, and then I'll answer them for you as they come up, or at the end. So first, a little bit about me. I received my undergraduate degree from Yale and medical training at the University of Connecticut and at Tulane. After finishing internal medicine residency, I did a preceptorship in office gynecology, and I also earned certifications from the North American Menopause Society in menopause management and the International Society for Clinical Densitometry in bone densitometry and osteoporosis management. I've been a board-certified internal medicine specialist for over 20 years. I've diagnosed and treated thousands of patients. I've devoted my career to advancing women's health care. I've served as a director of internal medicine women's health at a large academic institution where I saw patients and trained many young doctors. And I also built a pilot comprehensive women's health center for Inova Fairfax, right up the street here, the Inova Health System. And I most recently became a practice owner and a founding member of my own concierge internal medicine practice under the umbrella of Miss Medicine, a national practice model of women's health trained providers focusing on addressing the unmet needs of women. I became interested in a career in medicine because science was fun for me. I really enjoy it, and I knew that I would learn something every single day that I could turn around and then apply that information to help somebody else. I have a strong motivation to be of service in this world, and this has been a wonderful outlet for that for me. I've spent years caring for patients in a hospital, and that taught me how to handle complex health issues for my patients, to identify problems, to make accurate diagnoses, and then to help people recover. I've also learned that despite many advances, women's health care is still underdeveloped, and anything I learn that would be of assistance in women's health care would be helpful to my mom, my sister, or my best friend. So the topic for today's discussion has to do with knowing that there's a better option for primary health care in today's marketplace. And that's why I would like to discuss why you deserve better health care. The reason I founded Eileen West MD and Associates is that our current primary care system needs improvement. And I saw an opportunity to provide excellent evidence-based, comprehensive primary care in a beautiful clinic setting. My office is located here in Merrifield, Virginia, right around the corner from Inova Fairfax Hospital on Arlington Boulevard. The current landscape in healthcare is stressed under the weight of administrative burden and costs. Very good physicians are under a lot of pressure to see more and more patients in a clinic day, and to stay financially viable with overhead and changes in fee reimbursement structures. Overall, it really can, in some circumstances, create a really bad experience for the patient. You may have experienced the frustration of waiting for weeks or even months to see a physician. On average, Americans wait 24 days to see a new physician, and that number has gone up 30% since 2014. When you finally do get in to see the doctor or the mid-level provider, the appointment is often rushed. Right now, a healthy 30-year-old with no health problems other than seasonal allergies gets the same amount of time allotted to them as an 85-year-old with 12 medical issues who's on 12 or 15 medications. It's really difficult to balance those out and to get the information that you need and to provide the care that you want to offer in that amount of time. 7 or 8 minutes is just not enough time with a physician, and that's the average length of a physician appointment today. Wouldn't it be great if healthcare offered the same convenience, access, and customer-centered experiences you receive from other industries, like the restaurant business or retail or mobile technology? It's possible to get closer to that model. One of the tenets that I always follow in my offering of medical care is the importance of evidence-based medicine. It matters. You need to know that you're getting quality care, not just care. Maybe you've had the experience where something that sounded like a great idea really turned out not to be such a great idea. For example, a fabulous nutrition supplement that will make your hair grow and your nails grow and help you sleep better and make it easier for you to lose weight. So you bought it, you tried it for a month or two, nothing happened. Unfortunately, in the health and wellness sphere, there's a big financial incentive to put products on the market. Who doesn't want to live longer and look good doing it? Unfortunately, it can be hard to tell what medical treatments have been fully tested and proven to be effective in today's marketplace. My commitment to evidence-based care means that I can help you tease out what's been proven to work from what hasn't. One of the things that has come to be very important to me over my career is the importance of gender-specific care. Women have unique needs, and healthcare isn't a one-size-fits-all proposition. Specifically, if I've been interested in women's health because I've always had a strong community around me, and I've recognized the needs, that needs were not being met, and I wanted to help. For example, my mom, who's now 90, fell and broke her wrist before I started med school. And she was in her mid-50s, and she was diagnosed with a simple wrist fracture. Her doctor didn't recognize at that time that it was an early osteoporosis fracture. She did not start medication to preserve bone loss for another 10 years, and ultimately ended up having 6 more osteoporosis-related fractures. She required weeks in the hospital and inpatient rehabilitation to get back to her normal self. And that might have been avoided. She was lucky. She was able to work through that. 1 in 4 patients have serious health outcomes following a hip fracture. And hip fractures occur far more often in women than they do in men. In the 1980s, a real shift happened in medicine when public awareness became aware that the fact that medical studies largely excluded women. That awareness ultimately allowed healthcare through the lens of sex and gender to emerge. We now have much deeper understanding of the most common topics associated with women's health: breast cancer risk and breast cancer therapy, breast cancer incidence. We also understand health issues related to pregnancy and delivery much better. Things like urinary incontinence, which aren't easily discussed. We talk about women's sexual health. We've come to understand a lot more about that in the last 20 years. And also menopause management. Women's health is not just bikini medicine. That's the medicine that covers the boobs and the babies. Women are much more prone to autoimmune disease, to cardiac arrhythmias, to joint pain. And they are also prone to having different presentations of very common illnesses. So a female patient with cardiovascular disease who's presenting with a heart attack to the emergency room might have very different symptoms from a male patient who's presenting with the same diagnosis. A woman is 5 times more likely to be sent out of the emergency room with an active heart attack than a man is, because people just aren't aware of the symptoms. They're more likely to attribute it to something else, not just to the heart. We've also come to understand how hormones interact with medications and how the life cycle of a woman and the hormone fluctuations that she experiences can impact medical care. For example, insulin requirements for diabetics rise for a few days in women before and during their menstrual cycle. And if we don't understand that and manage that, then they may not optimally be controlled for diabetes. We also know that sleep medication doses need to be adjusted downward based on weight and sex. And we have frequently given women too much sleep medication, causing bad side effects afterward. There are so many examples of this and so much information that's being explored and developed now. It's a really exciting time for sex and gender medicine and healthcare. I'd like to switch gears for a minute and talk a little bit about what is concierge primary care. If we want better health outcomes, you, the patient, and I, the physician, need to spend more time together. Concierge care allows me to spend more time with you and to focus on longevity and prevention of chronic disease. Concierge medicine is an emerging healthcare model that focuses on accessibility, personalization, affordability, and ultimately better health and wellness. You can receive convenient, comprehensive care from an expert physician who takes the time to know you and your medical history, and I will help you build and manage a personalized care plan. Concierge physicians typically see far fewer patients than traditional medical primary care models, and those patients pay a membership fee to help cover the physician costs for this enhanced level of service. So what are the benefits of concierge care? Let's talk about why it might be impactful for you. There are many benefits to concierge care. For example, you have access to your doctor through phone, email, text, and that reduces wait times and ensures you get the most informed care, whether it's to address a routine question or to treat something urgent. It's also possible to spend more time with your physician. On average, concierge physicians spend 6 times longer with their patients each year. They are able to spend time not only helping to manage chronic disease conditions like diabetes and heart disease, but they're able to work together on comprehensive disease prevention, and also on longevity, with a focus on wellness, not just sick care. A more personal relationship is often one of the benefits of being in a concierge practice. Almost all concierge patients, 97%, think that their doctors take a personal interest in their health care, which is more than 1/3 higher than those in regular healthcare practices. And not only that, but they're more satisfied patients too. 90% of concierge patients are satisfied with their care compared to a far lower number in traditional healthcare. All of this adds up for you to better health. One concierge medicine organization reported 70% fewer hospitalizations among their patients versus patients in a traditional primary care office. And concierge patients were in the top 10% of national benchmarks for control of chronic conditions like diabetes, high blood pressure, and high cholesterol. Another concierge practice has gathered data for more than 10 years and believes that the life expectancy is improved by at least 5 to 7 years with their program. So all of this leads to my decision to go ahead and open Eileen West, MD and Associates. I am someone who values close relationships with others, and I want to bring a rigorous interdisciplinary approach to care. Throughout my career at larger health systems, I've had patient rosters up to 3,000 patients. and I was only able to spend an average of 12 to 15 minutes in an appointment with them. I want to be able to get to know my patients better. I want to provide more comprehensive preventative care, and I want to be there when my patients need me. At the same time, I wanted to go even deeper into healthcare through the lens of gender. I got connected through a colleague with Miss Medicine, which is a rapidly growing national organization dedicated to exceptional evidence-based women's primary health care. I had an immediate connection with the founder, Lisa Larkin, who's in Cincinnati, and I knew that we could be great partners. Last but not least, after 20 years of working in large healthcare systems, I was ready for the autonomy of running my own practice. And I'm really excited to be able to do things the way that I really think is the best way that they be done. So I opened a private concierge medical practice in the fall of 2019. It's a membership model practice. We're right across the street from Inova Fairfax Hospital, and I continue to be affiliated with Inova, which is an excellent hospital system in the area. I'm now able to care for a few hundred patients, not a few thousand. And I'm even more closely tied to women's health best practices through my association with Miss Medicine. I love my new job. So many primary care physicians struggle with burnout in today's day and age, and COVID really hasn't made it any easier. But in this model, with this care, the patients get the personalized care that they need, and the physician is also able to practice the medicine the way they were trained. So when I created this membership model practice, I recognized that it would come with some amazing benefits for my members. So what does a member in Eileen West MD and Associates receive? There's concierge level care through a gender-focused lens. There's all-inclusive primary care provided by me and for one annual fee. And that 24/7 access is guaranteed via office, cell phone, and email, and including telehealth outreach. So we can guarantee same business day or next day urgent visits by and large. We don't work with a mid-level provider, and you get more time with me and less time waiting. A 90-minute annual physical and wellness visit is routine here. And also you're able to come in for follow-up visits or problem-focused visits as needed throughout the year. There's no limit to the number of visits. We offer body fat composition assessment, and I have access to total body DEXA scanning, which is the gold standard in that industry. I am able to offer nutritional consultation with a dietitian who's been practicing and working in primary care offices for more than 20 years. Also included in the membership is a functional fitness consultation, and it can really help you jumpstart your exercise and fitness goals and get a full understanding with evidence-based guidelines for and norms for where you stand with fitness, wherever you are today. We offer breast cancer risk assessment up to and including genetic testing when indicated. We screen every patient for sleep apnea issues, for mental health issues, for sexual health concerns, and for notable vision and hearing issues. We also can help develop wellness and disease prevention strategies. We offer convenient access to in-office lab tests, vaccines, and medical supplies. We can coordinate care, and we can, with specialists and other medical testing, and we can even offer in-office IV fluids and medications when appropriate to prevent urgent care and ER visits. So let's talk about how this works. When you join the practice, you'll complete some membership paperwork and a medical history form and provide contact information for any specialists that you see. I'll review your history and schedule you to come in for an initial history and physical. After that, If you're interested in these specialty assessments, we can schedule a nutrition assessment for you and a fitness consultation, which is included in the membership. And then we can have any follow-up conversations and new issue meetings and appointments as they come up. And remember, I'm available on call as needed as well. At the end of the day, my office phone rolls to my cell phone and you call me directly. So you're worth this wise investment. The annual membership fee is $2,750, which is fairly comparable in this area. Some practices actually charge more. Our mission is to offer you high quality care at an affordable price. For one flat fee, we can care for you as a total human being. It's not the situation where you get one problem for a visit and you move through your visit very quickly. Under this model, insurance is not charged, and there are no co-payments. Each time you come in the office, when your membership is in good status, there is no fee for the time that you spend in the office. Because we don't bill or accept payments from insurance companies, the money which comes from memberships is used to pay staff, purchase equipment, cover the rent for the building, and any other expenses that come up in clinic. We have flexible payment options. You can pay annually, semi-annually, or even monthly if you prefer. And we also offer reduced rates for partner and dependents. And that can be spouses, it can be children. We see men and women, young adults between the ages of 16 to 26. And I see men as well. I really enjoy taking care of families. It's a lot of fun. A lot of people ask me how this works with insurance. So you should continue to have healthcare insurance to cover services outside of your primary care office visits, and for things like labs and imaging and prescriptions, visits with specialists, or hospitalization. Most insurance companies do not yet cover the membership fee as part of their insurance plan, but health savings account plans can be used. And some employers offer special healthcare options where they will cover the cost of the membership for the practice. Insurance will reimburse fees for in-office services like vaccines and point-of-care testing. We'll collect payment at the time of your appointment and provide a receipt for you to submit. Services are considered out-of-network and are not covered generally by Medicare. However, many Medicare patients avail themselves of this type of practice. Membership can result in lower healthcare costs for you. It includes multiple services that you would otherwise pay extra for, like nutrition and fitness consults, multiple in-depth assessments. If you have a chronic disease that requires frequent interaction with your primary care doctor, you may save on the cost of repeated appointments with a traditional primary care doctor. Convenient access can reduce your need for urgent care and emergency visits. And by being focused on personalized preventive health care, we're working hard to keep you healthy and out of the hospital. So, in summary, you deserve better than what you may already have. And if you want convenient access and more time with your physician, accountability with your healthcare goals, support on your wellness journey, and a relationship with a physician who truly cares about you, you consider calling my office or emailing us to set up your membership. Or if you still have questions, go ahead and schedule a personalized session on how we can identify your needs and tailor a plan that works best for you. It's like having a doctor in the family. Thank you so much for your time and attention. If you'd like to see the office, I'm going to post a short video tour on my website soon, and you can see it there. And I'll go ahead and open the discussion for questions now. Let's see if we've got any. All right, trying to find the chat. Give me just a moment here. Hello? Would this be a good investment for someone with chronic diseases? I would say absolutely. When you have an ongoing chronic illness, it's really important that you have somebody who can coordinate your care, somebody who can actively be communicating with your other physicians, who can make sure that duplicate labs aren't being ordered, who can really help to be the hub of the wheel with the various spokes going out to your different care providers, so that you have one centralized place where the information is coming to and where decisions can be made. You have someone who can cross-check and make sure that your medications are being managed correctly, etc. A number of my patients really enjoy this model of healthcare because when they need somebody, and they know that they'll be able to reach me. So, another question, I've heard concierge care has a focus on overall wellness, not just sick care. What does that mean? That's a great question too. I think wellness is it's not a new concept, because we've all been interested in wellness and prevention of disease forever. But what hasn't been able to happen quite so much in recent times is the inclusion of wellness in the primary care model. So when you think about wellness, you think about the things that you do with lifestyle that really can matter for you. Are you a smoker who's really working to quit smoking? Are you somebody who would really benefit from losing a few pounds? Are you a person who has always hated to exercise but wants to find a way to do better with exercise because you know how important it is? Are you somebody who doesn't really feel sick but is just experiencing some of the changes that come with aging, like going through menopause, which can be really trying for some people? All of those things are part of a wellness plan, and I really like to think of it in terms of really looking at the big picture. It's a full spectrum view of you as an individual and what we can do to help keep you healthy. So, if you'd like to learn more about the practice, yes, I would call us at 571-999-9378, and we'll be happy to help. So, let's see, any other questions? Here's one. I've been watching your social media and I'm interested in a women's health consult. What is covered in that type of appointment? That's a great question. I do offer consultations here on a variety of different disease states that occur more often with women. So I do menopause management consultations. I do osteoporosis management consultations, sexual health consultations, looking at different topics in a lot more detail than you may have been able to experience in another primary care office before this time. So a women's health consult would just involve making the appointment, knowing what specific topics you're interested in covering, and then coming in and bringing information about any past evaluations that you might have had, and we'll talk through the issues and your concerns, and I will examine you and then make some recommendations for how to improve any situations that are troublesome to you. So I'll give you a minute for any more questions. All right, well, if there are no more questions, you can feel free to ask more questions through Facebook, through a message, or by contacting the office directly, and I'd be very happy to talk with you further. So thank you so much for listening. Thank you for your attention today, and we really hope to see you soon. Take care now.